Hey Cam followers, it's episode 11. We are still here, still on our cuboidal pyramid that hopefully you can see. So as you have hopefully watched the other episodes, we've done our pain control, we've done about preventing further injury, we've done about pain control, we even touched on supplements and how difficult that is to advise. We're now going to skip across and talk about complementary therapies. Some people would like to call this integrative therapies, and in many ways I agree more with this. Complementary suggests that you can take them or lose them, maybe not. Integrative suggests that they have a real part of a management plan, and I would tend to agree with that more. Would you agree? Yeah. So let's call them integrative therapies. Let's step outside the comfort zone. We know now, and it is fully understood globally within the vet industry, that just putting a dog on an anti-inflammatory, which is a unimodular therapy, i.e. we're just using one therapy to control very complex disease, is pretty poor show. We need to be doing other things, but that could be weight control, exercise adaptation, home modifications, even simple things. Stop the dog jumping in and out of the car. Don't take them for as long a walk so that they're completely fatigued when they get home. All of this are strategies to controlling pain and slowing progression. But let's go a step further. Let's look at the therapies that we could add alongside our pharmaceutical approach. These are hydrotherapies, laser, shockwave therapy, acupuncture, massage therapy, and then there's many more, such as the Reikis and the homeopathies, which we're not going to touch on because they are quite a controversial area. So looking at the therapies that are snugly within integrative approach of physiotherapy, why and how and where? I'm going to quickly explain my understanding because I feel that I learned the importance of them quite late in my career. I was a unimodular approach. I believed that I just needed to control the pain and then the dog would fix the rest itself, because dogs are amazing. I like dogs more than people. Dogs are amazing. So if I can control that dog's pain, then they'll go back to walking normally and then they'll rebuild the muscle themselves and Bob's your uncle, there you go. So far from the truth. It's so far from the truth. So when you look at the process of arthritis and what happens, so let's use the knee as an example. So the dog has had a traumatic incident and it has ruptured its cruciate, and that cruciate being ruptured has led to that stifle being unstable. And it's that instability that creates a degenerative inflammatory process within that knee. So then you've got an arthritic knee, which is quite painful. And it's painful to weight bear and it's painful to move. So over time, that dog subtly weight shifts away. They carry on with life because they're amazing at coping. But over time, that dog has adjusted and adjusted and adjusted. And the three other legs will take more weight. And there might be a little bit of shifting through the spine. You have got muscle mass loss on this side and you've got soft tissue function loss. So those muscles aren't working optimally, they start to fade away. You have got muscle overcompensation, potentially on the other side and in the front end of the body. And you've got all the tissue in between. So you've got other areas that are potentially painful, struggling, just coping. And we've got this leg that hasn't been used for so long, the dog doesn't really know what to do with it anymore. So when you put that dog onto a pain strategy, to expect that dog to go, oh, right, guys, sorry, twice a day I've got to do calonetics, I've got to do my weight shifting, I've got to get my proprioceptive function back in this leg so I can use it properly, so I can use it safely. So I can start bearing weight and I can build that muscle up and I can then redistribute my weight back into that leg and then I'll balance myself. Doesn't happen. So that's where complementary therapies can be really, really helpful, integrative therapies. That's my quick take on my error of my ways in the beginning of my career. Add to it. What's your findings with your...
So I think the unimodular pain medication is really important to give them some pain relief, to then allow that therapy to happen successfully. So the point of things like physiotherapy and hydrotherapy, I always suggest we go to physiotherapy first and allow the physiotherapist to guide whether hydrotherapy is appropriate or not, is to retrain the body back to more normal function. So building muscle where it's been lost, reducing hypertone, muscles that have become
tense and
tight and painful. Exactly. Trying to resolve those in an appropriate manner, because sometimes some muscle tension is necessary to guard painful areas. So a skilled physiotherapist will know what muscle tension they should try to release and what muscle tension they should leave alone. Especially in hydrotherapy, they're trying to train a normal walking gait, a normal function. If we're talking about water treadmill, swimming is another.
There's going to be
aspect.
More episodes on this.
So they might use swimming for increasing flexibility and for gaining muscle, but they're quite different.
They're very different,
But again, it's still trying to bring back to normal function. Yeah. And even to the extent of, you mentioned in a previous episode, this concept of proprioceptive function, which is knowing where the feet are in space. Yeah. Having that link between where your limbs are and the brain. And that sort of thing is trained back in, which gets lost in a painful limb.
Just let's go and do proprioception, because I find this fascinating. The way that I know my finger is above my head is loads and loads of receptors sending information to my brain, and my brain making this algorithm of, I think your finger's above your head somewhat. And that is like proprioception. I know where my finger is because of all of this information coming to my brain. But that's lots of different tissues sending information to my brain. And that might be through ligaments, it might be through joint capsules, it might be through tendons, through muscle bellies, even through skin. All of that is sending information to my brain. And my clever computer up here is going, blah, 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 blah. Your finger is above your head. So when you start to lose tissue because of lack of use, then a lot of that information being sent to your brain is also lost. So you end up getting a really bad telephone call. You know what it's like when you're on your mobile and you're like every third word and you don't really know what they've said. So I might then start thinking that my finger is still above my head when actually it's over here. And we see that with these older dogs who have started to lose their soft tissue, and their placement, when they think they're going to land in a nice stable, sensible position with their right hind limb, it's slightly out of kilter, and therefore it shifts the whole body when they try and place weight on, because it wasn't stable, it wasn't good choice. That doesn't automatically come back when you start giving them pain medication. This is something that's really, really important to train back in, and you can do it in different ways. Some people will be restricted to how often they could get to see a physio or hydro, and they would have to do more of a home exercise plan. And they would have to think about where they walk, and they might incorporate incline walking, decline walking, stepping over poles, stepping over branches, things like that, to get information back to that dog's brain to rebuild that picture. Whereas other people might be more fortunate that they can see a physio or a hydrotherapist or other people in the industry, that their area of expertise is how to get back function. Because if we have good function, we have stability, and if we have stability, we have less pain. And that's what we're trying to do. We're trying to slow the disease and improve the pain state. So complementary stroke integrative therapies have a massive role to play. Yeah. But it goes back to working with your vet, dealing with your expectations, and having good communication in place. A good therapist will have goals that they're trying to achieve, and they should be communicating with you what these goals are, what their expectations, what their time frame is, to make sure that that intervention is working for you and your dog. So please make sure that you have a good communication. There's report writing, so there's communication between the vet, the therapist and yourself. Talk to them and say, how long, how many sessions, how frequent for me to see the benefits of my labour. So make sure that you've got an open discussion with them. But no one can give you a crystal ball. No. Neither me or Gwen.
You might not know how many sessions it's going to take.
No, exactly.
And that's going to get reviewed as your dog progresses through.
Yeah, exactly.
How many sessions he's going to need.
And that's the same with anything that we do with arthritis. There is no crystal ball. So whether you're choosing a supplement, a change of food, a new medication, or an integrative therapy, there is no crystal ball that this will definitely work. So which is why in a later episode, we are going to teach you how to take control of the case, because you are the commander of this case. You are the person that's going to say, yes, this is working, because I've seen my dog's signs of chronic pain and dysfunction improve. This intervention is working. Or you might say, I have not seen my chronic pain indicators and signs of dysfunction improve. This intervention is not working. You are in charge of this case. No one else is your crystal ball, I'm afraid. So that's integrative complementary therapies, just in a nutshell. There are many, many episodes that are developing in this channel to talk to you in greater depth about, be it physio, be it laser, be it hydro. So they will emerge with time, but this is just an overview so you understand why it has a role to play. We've got one more episode with our cuboidal pyramid to come, which will be episode 12, which is rebuild, which again is something that I'm really passionate about. So we will see you then.